You have a responsibility to this community as a nonprofit hospital. And so my question, as a nonprofit hospital, Phoebe does have a responsibility to provide care to everyone, regardless of their ability to pay, if I'm not mistaken. And if this is the case, why is there the need for something like a Samaritan Clinic? And how do you go about selecting those patients that you may deem unfit to be seen at Phoebe?
So we have, as any hospital has, policies around charity care and who qualifies for it. So by law, every hospital is required to stabilize a patient regardless of their ability to pay in an emergency room. That's just federal law. That doesn't necessarily mean that doesn't translate into outpatient clinics and other things. We do have a policy related to charity care, so I don't think we brought it tonight, but it's available on our website, and it's basically based off the federal poverty level that the federal government stamp that they state every year, and by whatever percentage you qualify, no matter what services you get from Phoebe. It could be emergency room, it could be outpatient care. So we do have that. We have one of the most generous charity care policies in the state of Georgia. It's 400% of the federal poverty level. You still qualify for some level of charity care. Much of the time, it is zero would be the cost for it. I think the Samaritan Clinic is a great service to the community. It's been around for so many years. We support the Mount Zion and that clinic in a variety of different ways. Why does something like that have to exist? I think they exist in every community. If it didn't, I'm not exactly sure what would happen. But I'm glad that they're here. I think they do a great job, and we fully support what they do. I don't have a perfect answer for doing away with that service for you. I think what we do is we try to balance our giving, whether it's services or whether it's a policy or whether it's just straight donations, to what we can afford and what we can do each and every year. And sometimes that in years it's more than others. And to me, the Samaritan Clinic does a great job, and we're happy to support them.
I'm sorry, I don't think you quite answered the question in terms of how do you select people to go to the Samaritan Clinic? Because some people have stated they weren't able to get care at Phoebe, and I guess were sent to the Samaritan Clinic, so can you speak to that specifically?
To my knowledge, we don't have a selection criteria for it. I imagine people might be told about it here and there, but there's no policy, there's no, hey, if somebody presents this way or with this funding source, send them to Samaritan Clinic.